I'll introduce my mother shortly, but I want to give you a quick rundown of Relationship Unleashed. Our website is runl.org, just in case you don't know it, runl.org, one word. But today we're celebrating a historical moment in our Relationship Unleashed organization. We have our own space. Touch somebody, don't touch nobody, say neighbor. We have our own space.
We got our own space.
One more time, say neighbor. It's possible.
It's possible.
I don't care if you don't have any money. I don't care if you're afraid. I don't care if you don't know how to do it. I don't care if you don't have any help. It's possible. Touch your neighbor one more time. Don't touch him. Just lean on him. Say, neighbor, it's possible. This has been 7 years in the working and the making, and God has blessed us to open up our own space to help our community at large, and we are looking forward to doing mighty, mighty good work. We have great community partners, Spirit Healthcare. Wave your hand, Dr. Mary Bernard. If you need a physician, a doctor, primary doctor, she take care of my grandmother, my mother. I may transfer over in a little bit, but Spirit Healthcare, go see Dr. Bernard before you leave. She is a primary physician, and she will take care of you until you can live a long, healthy life. But we have many community partners. Some are here, some on the way, but we are excited to help our community. And we've been struggling for many years, but now it's our time. It's our time to help people. It's our time to liberate our people. It's our time to uplift our black and brown sisters and brothers, and especially black folks. So we have a lot of work to do. We're going to need help. We're going to need volunteers. We're going to need motivation. We're going to need your energy. We're going to need your help. But once we apply for more funding, we'll be able to compensate people for helping us, because I know money motivates people, I understand, but we can't get money if we don't have help. So we need your help to make this dream and this vision come true, and we just need your help. So I'm not going to talk that long. I'll bring my mother up, and we'll bring up the other speakers before we go cut this ribbon. But my mother has retired from her occupation, and this is a dream come true for you to retire and have your own, be your own boss. Amen. It's her turn. Tell somebody, neighbor. Amen. It's your turn. Not hers, your turn to be your own boss. Dr. Bernard, she's her own boss. Shauna, her own boss. Be your own boss. Don't take no, Melissa, her own boss. Attorney Melissa, it's the time to be your own boss. And so this is the season, this is the time for you to be your own boss, make your own call, be the shot caller and the baller. This is the time to do it. Don't be afraid, don't worry about the naysayers, just do it, because it is possible. But we have many campaigns coming that we're going to be running here in the city of Memphis. I'm going to get my cheat sheet right here. We have a campaign we're going to be running through the Center of Disease Control. It's entitled Wrap Around Memphis, but we're going to be focused on the COVID-19 epidemic. As you know, we are going to be promoting black folk, get your shot. I know people are hesitant, I understand, but black folk, we're dying, we have to get this shot. The Delta variant is for real, it's out here, it's running rapid. In the next couple of weeks, we'll have billboards throughout the city of Memphis encouraging people to get shot through Relationship Unleashed. So if you want to be a part of that campaign, get with myself and my mother. You can have your pretty face on the billboard, only if you got your shot. So we're going to get some billboards up encouraging people. We're going to be referring people to Dr. Bernard to get the vaccine. We're going to be working with the Shelby County Health Department. We have another program called Wrap Around Memphis. I'll let my mother speak more about that. We'll be working with our black trans community, our cis black women. We're going to be working with the community at large to uplift our people. I'll be working with younger brothers who identify as gay in the LGBT community. We'll be working with all the above. My mom can work with women in the community. So we have a lot of work to do, but we need your help. So spread the word, share the information that Relationship Unleashed, we are here, we're not going anywhere, and we have a lot of work to do. But let me introduce the visionary of this great organization, the workaholic of this organization, and the great poet once said, this is a man's world. The great poet. Great poet. He said, this is a man's world. Y'all don't know that poet? Reverend James Brown said, this is a man's world. He said, but it will be nothing without a woman or a girl. I'm going to introduce y'all to the Executive Director of Relationship Unleashed, the retiree, Miss Gwendolyn D. Clemons.
You go now.
Hey, listen, he said a whole lot, just sharing about the programming and the things that we have in store for our community. And that's what a nonprofit is, in case you all didn't know. It exists for the sole being of the community. This nonprofit belongs to you all. It belongs to you all and the board of directors. So the things that we're doing, we identified some areas that we felt like there was a great need, and that was one of the reasons that we launched Relationship Unleashed. And it's part of the Unleashed family. I'm wearing one of my t-shirts. Okay. I am unleashed. Yeah. So we have right now 3 funded programs, as Damian mentioned. One is the Path Forward, and that's through the CDC Foundation, funded through Google. And it's a 6-month project where we're going to be working with other community organizations, helping raise the awareness about the hesitancy of the coronavirus vaccine in the Black community. We have 8 zip codes identified, so you're going to see these billboards popping up around the city for that campaign. And we're also going to have paid canvassers. So if you're not following us, I encourage you to follow us, to get in, to make you some money, to pass out flyers. We're going to do a little footwork, not too much because it's hot, but we're going to have paid canvassers. The second, I'll be putting it out. The second campaign that we will be running is called Wrap Around Memphis. And this is a big program. It's funded for 3 years through Harm Reduction Coalition. And we're very fortunate to be a grantee of that project. And Aliette is working with us on that, and she's gonna come up and share a little bit more. But we need feedback from you today. That's why we have a listening session. And the third project is called the Black Church, Faith, and HIV and AIDS. So we're gonna be doing faith work, talking about dismantling stigma that exists in the community toward people that are living positively with HIV and AIDS. Whether you know it or not, this is not a gay disease. Black women, you are in danger right now. You're coming up the ranks for testing positive in Memphis, Tennessee, and Shelby County. We are in the top 10. We've been in the top 10 for the last 40 years. We go from 1, 2, 3 to 8 back up. So Shelby County, whether people want to ignore if we have a problem or not, but we have a problem. Houston, we got a problem. So that's one of the things that we're going to be doing. And we know that faith has a stronghold on people in our city. And one way to dismantle that is to address faith in a holistic manner so that we can be the beloved community and love people and reduce the stigma, because whether these congregations know it or not, you have individuals sitting right in your pulpit, in your congregation that are living with HIV and AIDS and cannot receive a welcoming hand from the church, the place where you're supposed to go for the sick. That's where you're supposed to go to get your healing. To have people to pray for you, not send you to hell. So we got a lot of work to do, and it's God's will, God's plan. And I told somebody earlier, Miss Paula, she almost made me cry, that we've been tarrying 7 years. 7 years we've been tarrying. And if you don't know what that means, some action needed. But this is a manifestation. This is praying, asking God to bless us in some form or fashion. And fortunately, we've been faithful. And if you're faithful over a little bit, what the Bible says?
He'll make you rule over men.
Hello. We got some Bible speakers here. So that's what this is today. But I'm not going to prolong you. We're going to have Dr. Bernard to come up. She's our guest, and we were supposed to have Walgreens here So we don't know if Dr. Nate is running late. Come on, doctor. And so we need y'all input. We need y'all to ask questions about the coronavirus vaccine, because if you've been watching the news, they say that we're gonna have perhaps take a third shot.
Booster.
Pfizer.
Booster, yeah.
The CDC said there's no need right now, but Pfizer must know something. So, nevertheless, if we gotta take one, I have a Pfizer, I'll be in line getting my third one. So we have a public health expert, a medical expert, that can answer some questions, and what she can't answer, we will get you the answer. Within the next week, we'll get you the answer. So we want to address whatever it is that's causing people not to become vaccinated. And if you haven't been vaccinated, there's no shame in here tonight. Whether you have been vaccinated, you still may have some concerns. We want you to ask good questions so we can get you some good dialogue. She's gonna take over about 15 minutes with the back and forward. And then we have another, Aliette is gonna take over about 15 minutes. So we don't wanna tie your whole day up, and then we'll do the ribbon cutting, and then you have your Saturday. This is Dr. Mary Bernard.
As has been said already, from Spirit Health, we come from a place of primary care, and that means prevention. We believe that in order to live healthy, you got to prevent some things. We work on preventing hypertension, we work on preventing diabetes and other disorders, and we need as a whole to work on preventing infectious diseases, HIV, hepatitis, and even this coronavirus. A lot of people are afraid to take the virus because of past medical mistakes, namely Tuskegee. I make sure that people understand what happened with Tuskegee. They denied treatment. They just didn't treat the people. They withheld the treatment and monitored to see what would happen. And that's how we know the stages of syphilis from the Tuskegee study. This is a different type of thing. They're not denying us anything as a race of people. They're not denying us anything. They're offering us the same thing. Well, I've had people say things like, they made this virus to kill black people. Well, if they did, they're going to be successful because the black people are the ones who are hesitant to get vaccinated. A few points I like to mention with my clients on why I got vaccinated. First thing I noticed is who was getting vaccinated. I noticed that all our world leaders were getting vaccinated. I realized some of our famous scientists were getting vaccinated. Our rich folks, Oprah, she was up there early, getting vaccinated. And the people that we would need to help us, the doctors, the ambulance drivers, the firemen, the policemen, and even the jailer, those are people that we would have to encounter. And if they're all vaccinated and I'm not, then I feel left out. And this is a case of reverse Tuskegee as far as I'm concerned, because the opportunity is certainly there. I'll admit now, since I think I'm safe, I cheated to get the first shot. I was in line first. When Shelby County opened up that website, I got my first shot, December 28th. December 28th, I got my second one at the end of January. And so far, I haven't turned blue. Things are still working okay. And I feel fine. So I'd like to take this time to entertain any questions that you may have for getting the virus, about the virus, future research, what's going on, because there's data that's out there and it's very available. Questions? I see a hand back there.
Do you mind explaining what's the difference between the coronavirus and the new Delta strain that they're running?
Okay, the question was, what's the difference between the coronavirus and the Delta strand? So you make me go backwards a little bit. And first of all, remind us that corona is not a new virus. It's been around a long time. The reason we call this one COVID-19, it was the coronavirus, COVID, the virus of 2019. That's when the first case came out. And that virus, like many, if you introduce it to a little resistance, it kind of reminds me of drinking. The first time you drink a beer, you get drunk. Second time, not so much. Third time, and it gets take more and more. Well, with this virus, when there's not sufficient holdback, it mutates. It makes different forms of itself. And when it makes different forms of itself, it's still corona, but it's just a different strand of it. And right now, we do believe that the vaccinations will protect us against the Delta strain. We still believe that. There's still research on that. And as Ms. Gwen said, there's research on booster shots. But I personally believe that it's gonna be a yearly thing. Good question. Other question? Ms. Lucretia?
Well, me being who I am, I talk to a lot of people. And I lived during the time that they gave the syphilis shots to many people. And a lot of them didn't get recuperate. I was there, watched them load them up on the buses. So people kind of refrain from that. Then you got other politicians and ministers and stuff speaking against the vaccine because of what it's made of. So you would have fear of that because they load them up, and we always want that generally pinpointed to accept everything, you know.
Well,
We are the guinea pigs, so to say.
let me address some of what you said, because I want to catch every point. The first thing you mentioned was about Tuskegee and what happened. I want to be clear what